Hello everybody, my name is Victoria and I have a very rare complication after the fly vaccine, transverse myelitis with lesions in the spinal cord and lower paraparesis as a result. I have been fighting for several years to be able to walk because my muscles are so tight and spasmodic that without medication they simply tear, and small blood vessels also tear. To explain simply what spasms are, they are muscle tightening in a cramp which is very painful, and this cramped state lasts all day and night long. I have good days when I can walk with pain and medication, and bad days when I cannot go far because the pain and muscle spasm are terrible. But it didn't start right away. 5 years ago, I was a completely healthy person. This will be my vlog about my life, about how I try not to give up, and in order to understand me a little more, you need to know how it all began. So, how did it all start? It was a normal day. I was full of energy as I started my studies, which also count as full-time work at the hospital. Less than a month had passed since I started, and it seemed nothing could break my determination. How wrong I was. It was the first year of COVID. The COVID infection had begun to spread, and at the time no one knew what to expect from it. Vaccination was also highly recommended against the fly. Why vaccination is important in the healthcare sector? The aim was really to protect others, because work and training often take place in hospital wards and rooms where seriously ill patients are fighting for their lives and quality of life. And such a virus, the fly, can not only complicate everything but also have lethal consequences. As I said, the morning was great and I was not worried about getting vaccination at all because I had already had the vaccination a year ago and knew that I would have a slightly elevated temperature for 2 days. Before that, however, there was a very strange event, and that for a long time seemed like something out of fantasy series to me, perhaps a sign from above. A soldier developed myocarditis, inflammation of the heart muscle tissue, after being vaccinated. Since this is not usually widely discussed, I couldn't believe it for a long time, and it seemed to me that so many factors would have the consequence for something like that to happen at all. So when getting vaccinated, I had to sign a form, which seemed like a routine procedure. Later, I learned that this is usually done with experimental vaccines, which means that the vaccine composition is new and has not yet been tested. But at the time, I didn't really pay attention to it. Of course, I had fever that evening and next day as well. Headache, migraine. 2 days after the vaccine, I woke up with a terrible headache, so severe that getting out of the bed seemed like a challenge. Looking out the window, I felt like my head was going to explode, just like when I stood up. When I got up, I felt like the pain was pushing me down. I realized that I had a migraine. At least that's what I seemed like to me. Of course, it was unpleasant, but it wasn't the end of the world, and I could turn to it for 1 day a year. I spent the whole day in darkness in bed, isolated from any sounds as much as possible. As I said at the time, in a bad vision. I also took painkillers, but didn't feel any particular effect. I went to bed optimistic that tomorrow would be better. Needless to say, that next day morning brought no change. I was unpleasantly disappointed, but thought, well, at least it will be easier by evening. but it didn't go away. I thought it might be a long migraine episode, but I was sure that tomorrow I would be as good as new. Morning came, but there was no change. I started to think of other possibilities because I was no longer convinced that it was a migraine. I realized that it could be sinusitis, as the symptoms seemed to particularly match. From medicine, I knew that not everyone experienced the same symptoms 200% of the time, and here was my extraordinary sinusitis. My head was dull and painful, and bending my head down made it worse. I went to look for my leftover antibiotics. I started taking them. After 1 to 2 days, I felt a little relief. At that time, I had a very cool department head during my study who recommended that I go to auto ear tooth doctor, who in that day have one uncovered visit. I had a computer tomography scan of my head and everything was fine. But considering that the antibiotics had worked, he added another antibiotic and increased the dose of the previous ones, because not all inflammation can be seen without delay. Perhaps they are small, but symptoms can be large, as in my case. Sharp, severe abdominal pain. After a couple of days, the headache went away, but then my epigastrium, the middle of my abdomen, started to hurt. No wonder with such doses, I thought, remembering my gastritis. Apparently, my stomach patient has run out. Oh well, a week to 10 days of antacids, a light diet, nothing acidic, no coffee, and everything will be fine, I thought. After a day or two, the pain shifted more the right side of my abdomen. The pain was unbearable. Sharp, colically, sudden pains that stopped without stopping, with short or longer breaks, but with each step it felt like I was ready to crawl after sailing. None of the medication relieved the pain. After 2 sleepless nights, I went to the emergency room. There, they told me that I have definitely frozen my intercostal nerve, that I was overreacting because at my age, nothing serious could be wrong, and sent me home, which I did, hoping that maybe it would get better and go away. On the way back, my hopes faded, and the pain remained as strong as ever. Another sleepless night. At the same time, I felt that the right side of my body, below my chest, was getting worse, which I also mentioned, but they dismissed it as anxiety. After this sleepless night, I went to the second largest hospital early in the morning, were there again trying to tell me something about intercostal nerve without doing any specific tests, just an ultrasound of my abdomen. After giving me medication, also including light narcotics, which did not make me feel any better, I was sent home again. At home, an unforgettable day and evening awaited me, which I spent hugging the toilet, as my stomach had never felt so bad before. When my stomach settled down, I realized that there was also a positive aspect of it. Vomiting and suffering from pain is much harder than just suffering from pain. These thoughts did not last long. Third attempt. I spent the next few days at home, unable to sleep. Michaela, the cycle manager, the same one who recommended the doctor, who was sick at the time as I, and I asked how he was doing, he asked how I was doing, and I described my failed attempts over the past few days to understand what was really going on. He told me go to the hospital for the third time and not to leave until I had a diagnosis. It sounded very simple, but really I had nothing to lose, so I tried again. When I arrived, the same procedure was repeated, and when I was being discharged, a neurologist passed by me and found that I couldn't really feel my right side, especially my leg. He said that I definitely needed to be examined and have an MRI scan. We agreed that I would be admitted to the ward for 2 days for the examination, considering that it was the beginning of the COVID infection. The work of the department was also somewhat limited and a bit chaotic, as new departments for COVID patients were being set up in the hospital, so for safety reasons, no one stayed there for longer than enough. The doctor on duty was pleasant, and we joked that it was probably a slip disc, which would be confirmed by the examination, and when I would have to work with physiotherapist, which I was basically mentally prepared for. The most frightening thing about all this was living in ignorance, because you don't understand what to really prepare for. I wanted so much to understand what was happening to me, even if only a little. After the examination, I went home because we agreed with the neurologist that we could not expect an answer about disc displacement in the hospital until the evening. Late in the evening, the diagnosis arrived and I finally knew, but I still had no idea how much it would change my whole life. Diagnosis. Late in the evening, I opened the report and reading the diagnosis, tears rolled down my cheeks. I was mentally prepared for a diagnosis similar to this one, a disc displacement of hernia at some level, but I read transverse myelitis in the spinal cord with lesions at the 7 and 8 thoracic levels. I started crying, tears were streaming down my face, and I felt a slight panic because I knew that to do if there was a hernia or disc displacement, but I had no idea what to do with brain damage, as at that moment I just understand that it was serious. At the end of the discharge form, it said that I had to go to the hospital on Monday. Over the weekend, I calmed down a little and realized that a huge weight of ignorance had been lifted from my shoulders. Yes, as they say in Latvia, shit happens, but at least we know what kind of shit. The path to therapy. On Monday, I checked into the ward, still in huge pain, already having difficulty walking on my right leg. I thought the treatment would begin as soon as I would be in hospital, but instead, a long series of tests began, anything but not treatment, because they explained to me that in MRI, the contrast did not accumulate in the areas of the spinal cord during the examination. So they tried to convince me that this procedure, the areas, are old. And no one took my story about antibiotics that could even help a horse, took it seriously. Please remember this moment. This week was terrible. They took countless vials of blood, poked my spinal cord to obtain cerebrospinal fluid. It would have been fine if it had worked the first time, but someone had to lend a hand, and it took several attempts. A huge thank you to my roommates. The best girl ever. Well, in really woman and grandmas, but I always affectionately refer to woman as girl. After the procedure, I couldn't walk for 2 or 3 days and couldn't lift more than 500 milliliters of water. They really brought it to me, gave it to me, stayed with me for the first few hours so that I wouldn't fall on my way to the toilet. I said that everything was fine, but such support is very welcome. At night, I read all the medical journals and databases to find a treatment for myself because the pain made my pulse race to an average of 110 to 120 beats per minute, and it was impossible to sleep. I found about hungry confirmation that these were the effects of the flu vaccine with various treatment regimens. A week passed. At night I studied neurology. During the day I did tests for everything unreal that was going through doctors had at the time, but time was passing, which was very important. Time when it was necessary to start treatment. The following week arrived and I wanted to share my research with at least the head of the department, telling her that I found a syndrome that I met all 9 criteria for and the treatment. The neurologist's verdict was that first of all, the head of the department was very busy this week and did not have time. And secondly, these were old problems that I would have to live with for the rest of my life, along with the pain, and they wouldn't conduct several more tests this week, and then I could go home. No treatment. In literally a month, I went from being a completely active person to someone who lives with unbearable pain and drags the right side of my body along with me. And they say I have to accept it and live like this. I realized that at that moment I had nothing to lose. So I said that after they started treatment, me according to the plans I had found, or I would go to another doctor at another hospital, and if they could help me, we would meet at another institution. Within 5 minutes, the head of the department arrived and said that I had misunderstood, that they had intention to start therapy, and that I didn't matter, that a few minutes earlier they had said there would be no therapy. They started therapy. It was difficult, but on the morning of the 3rd day, I said that the pain was already less and easier to tolerate. I noticed the look in the neurologist's eyes, which clearly say that such fantasies should be treated elsewhere, and that, in their opinion, I was a little crazy. At the same time, my legs started to respond a little better. On the 4th day, the therapy was very difficult to tolerate, and there was even a moment when I wanted to stop because my heart rate was 120 to 130. My cheeks were burning and I was a little dizzy, especially in the morning, and my blood pressure was quite higher than usually. My daily blood pressure had always been stable at 90 to 60, so the fact that I felt bad at 127 to 84 didn't bother anyone, to put it mildly. I endured all the treatment. They sent me home without really explaining anything, since I was pumped full of hormones in a huge dose. I took everything more emotionally, took a deep breath, and promised myself that in the coming years my feet would not be in the neurology department, no matter what. A bright feeling of happiness. That feeling of happiness when you get home, curl in bed, still in pain, but pain that can be relieved with medication and the right sleeping position. My happiness lasted a little longer than a day because, as it turned out, my adrenal glands failed me. So that after large doses of hormone, I had to prescribe small doses at home, which were gradually reduced so that they would have time to resume their work. Because when they get used to large doses of hormone, they simply started to believe that producing hormone is no longer their job, and they gradually have to be reconnected, so to speak. So how did it manifest itself? As soon as I stood up or sat down, I lost consciousness. For about 3 weeks, I tried to get to the toilet quickly. It's a good thing that I didn't live alone. I even had my own routine. I would slide across the bed and then crawl quickly to the toilet. Needless to say, I eat almost lying down and try to drink as little as possible so that I would have to get up as little as possible. If something like this happens to you, don't be as stubborn and stupid as I was, because it's turned out that this is life-threatening situation. And there is also a high risk of death if the adrenal glands stop working. But at that moment, my hormones were raging and I was ready to crawl, but not go back to place where they didn't understand my condition, or it seemed to me. After a month, the situation improved. My pulse was still around 110 to 115. The pain had subsided and I was gradually starting to move. But I still spent a lot of time lying down so that the pain wouldn't be so severe. Old or new lesions in the spinal cord. I consulted several neurologists, but it was quite difficult to find the right one. One dedicated more in headache, other in other areas. My diagnosis was rare until I finally, honestly, one of the smartest in this field. He finally explained it to me in human terms what was happening to me, because even though I am a medical worker, when something very serious happens, logic goes under the window and you need someone to explain everything to you in human terms. My therapy was also arranged. Mild anti-anxiety medication was prescribed in that time. And if any of you are going through hormone therapy, anxiety is a completely normal part of it. Even after the therapy is over, give your body time to cope with it. A new examination was also prescribed and performed, as the doctor was convinced, just like me, that the nodules were fresh. What do you think the result of the examination showed? You can put the pause and write your answer. I contacted one of the most knowledgeable radiologists and she said that the lesions had decreased by 40%. Old scars do not diminish. Always fight for your health because no one will care about you as much as you do. I thought I had gotten through the hardest period, but I was wrong. If you are currently undergoing difficult treatment, know that you are not alone. Don't give up. Please write in the comment if anyone has had a similar treatment experience and how you coped with it. I would be happy if you follow me and liked my video. The continuation will follow in the next. Please take care of yourself and your loved one. Bye bye.